The number of drug overdoses so far in 2020 in Minot has already surpassed 2019's 12-month total. Carissa Stinchcomb spoke to the Minot police chief to find out what the department is doing to keep this number from climbing, and she also spoke to a behavioral health expert to find out the risks and signs to look for when it comes to overdose.
A bad batch of narcotics hit our community, and that's why we've seen such a large spike in such a short period of time.
In 2019, there were 29 overdoses and 3 overdose deaths in Minot. Within the first 4 months of 2020, there have already been 31 overdoses and 6 deaths. Police Chief John Klug says he thinks the increase is because of drug availability. He also says it's laced with fentanyl, which is between 50 and 100 times stronger than morphine.
Somebody that might at least have some tolerance or some be used to a little bit of what they're using gets a bad batch, and it's higher in fentanyl than what they know or what they even expect, and they end up overdosing.
The Minot Police Department is working with the Ward County Drug Task Force to identify the dealers and source of the drugs.
They can investigate the death, and they can investigate the narcotics side, which our narcotics investigators are just a lot better at knowing the different people involved and where the different narcotics might be coming from. So that connection is going to be key to solving some of these cases.
Despite a common belief, those suffering from substance abuse aren't the only people who can overdose. If you're taking an opioid prescription, taking more than one medication, or taking someone else's opioid prescription, you're at risk too. So, what are the signs of an overdose?
Someone's face being clammy to touch and have lost color, their body is limp, fingernails or lips may be turning blue or purple, and they just can't be awakened.
Anderson shares some life-saving tips if you are around someone experiencing an overdose.
You utilize that naloxone, provide rescue breaths, and call 911.
Naloxone is a life-saving medication commonly known as Narcan. There are laws and resources available to protect you if you're around someone who has overdosed. Getting people the help they need is important, but stopping the source is the police department's mission.
We know there's going to be overdoses. We want to stop the deaths from occurring in our community.
Reporting for KX News in Minot, I'm Carissa Stinchcomb.